Ojibwe. We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabeg, the Three Fires Confederacy, Ojibwe, Ottawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation.
Good evening and welcome to the last Zoom board meeting of 2021. I'm going to call the meeting to order. Any declarations of conflict of interest? Seeing none, thank you. Can I get a motion to approve the previous minutes? We have Patty France, seconded by Penny Allen. Thank you. Questions or comments with regards to those minutes? Seeing none, all in favor? Perfect, that's unanimous. Like I've started every meeting for the last year or so, I'll just give a couple updates. So number one, the 50-50 draw is live. If you are looking for Windsor Regional tickets, they are on the Windsor Regional Hospital Foundation website. Next thing is, for anyone considering donating toys to our pediatric unit, we want to thank you for your generosity. Those toys would be better served going to our friends at the Hiatus House or at the Children's Aid Society. I promise the kids in our pediatric unit are being taken care of extremely well. So those toys will be better served going to kids that may need them more than the ones in the hospital. And again, they are being well taken care of. So thank you for your generosity. If you do want to make donations to our pediatric unit though, please visit our Windsor Regional Hospital Foundation website. Third, as this is the last meeting for 2021, I just want to say thank you to all the staff for continuing to support our community, to our amazing partners at the City of Windsor, the County of Essex, Weechu, Erie Shores, Hotel Dieu, the province of Ontario. It's been an incredible year, and please know I'm missing a lot of our community partners, but thank you for making this year as successful as it could be. There were a lot of challenges, but I think the teams from all of these organizations have come together and worked extremely well to keep us safe and sane during this pandemic. So thank you for that. And lastly, to our community, thank you for your support, your generosity. And please remember, if you haven't been vaccinated yet, get vaccinated. And secondly, if you are eligible for your booster shot, please make your appointment. There are a lot of people waiting in the queue, so get online, book your appointment. With that, have a very safe and happy new year, happy holidays, and we'll see you in 2022 and well, throughout this meeting. So on to David Moucher for the President and CEO's report.
There we go. All right, thank you, Mr. Chair, and thank you everybody for attending tonight's meeting, both via Zoom and out in our community, our Windsor Essex community. Just wanted to give you some updates where we stand with respect to COVID, and here are some numbers in the trend line that you can see going back to the middle of November, and how the cases in the province of Ontario, the red dots are the actual new cases on a given day, and the blue line is a rolling 7-day average. So you can see how the rolling 7-day average keeps increasing, and today we were north of 1,200 cases, actually 1,290 cases today. You know, the doubling time, unfortunately, keeps going down. which does not bode well with respect to where things are tracking provincially. And again, we're going to talk about Omicron later, but this is 99.9% or very close to it Delta cases. So we're dealing with the Delta variant right now. Omicron really hasn't even taken effect, and Dr. Saad will talk about that a little bit later. So just give an idea where Windsor-Essex is, and you'll see the trend line starting at the end of September. Again, the blue is the new cases that we've had in Windsor-Essex, and the red line is the 7-day average. Today, it's going to be back up with respect to, you can see 120, pretty much 120 cases is the blue line. And again, the red is the rolling average, but it continues to go up on and this is important because it's going to come into play a little bit later in my discussion, is the weekly cases on the left-hand side show that Windsor-Essex is at 114 per 100,000 of our population, and our positivity rate is just under 6%. So those two numbers are not good at all, even though it shows we've gone down a little bit in our weekly case counts per 100,000. Overall, it's going to go back up. It's trending back up based upon even today's results. So we'll start seeing where that goes. As you can see, we're in the top 3 or 4 in the province of Ontario. Now, we have to put this into context to see where were we last year at this time, if you want to give kind of a contextual view to say, okay, how quote bad is this possibly? And if you look clearly, as the far left is that number is what we were, our case counts as of this date last year was running at 67.3 positive cases a day. It's now running on an average of about 69.9 positive cases a day now. So we're a little bit above last year at this time, but you can see what happened last year at this time. That was a big increase as a result of, at that time, that was more like wave 2 numbers and what happened over the holiday season. So in context, we are clearly, about the same, a little bit worse than last year. The issue becomes what's going to happen over the next couple, 3 weeks with respect to our case counts and where are they going to go. This is always a question that people say because they look at even our internal statistics, and Karen will talk about that a little bit later, with respect to the number of positive, clearly positive COVID patients we have and how many of them are vaccinated. And people will say, oh, your vaccinated patients are going up as compared to your unvaccinated. You got to take a step back. Our vaccinated population of 5-plus-year-olds in the province of Ontario, fully vaccinated, is over 80%, 5+. So that means 8 out of every 10 people are vaccinated. So when we look at our numbers, and you'll see later on, we still have over 70% of our inpatients are unvaccinated people. That 70% is coming from less than 20% of our population, and actually even less than that, because this is 5-year-olds up. This isn't even adult numbers. So when you look at the chart on the left, that's where you get the difference, where it says, why do they say it's harder to become COVID positive when you're vaccinated? It's because statistically, mathematically, you're pulling from a much larger sample of individuals from the vaccinated point of view as compared to unvaccinated. So most recently in the Science Table report that came out a couple of days ago with respect to projections, still unvaccinated people have a 5-fold higher risk of symptomatic COVID-19 disease, a 13-fold higher risk of being in the hospital, and a 23-fold higher risk of being in the ICU compared to the fully vaccinated. So people will say right now we have 5 people in the ICU and one of them is vaccinated. They'll say, well, that's 20%. It's like, yes, but that one person is coming from over 80% of our population. The other 4 are coming from a very small segment of our population. That's where you get the 5-fold, the 13-fold, the 23-fold. is just the mathematical equation of that is it's far easier, or the numbers of individuals getting COVID and unfortunately being hospitalized and in the ICU and still passing away, unfortunately, as pointed out by our Chief Medical Officer of Health today, is largely, if not exclusively, unfortunately, the unvaccinated individuals in our community. We've talked about this, is there's not just one thing. You know, people want to focus on one thing and they'll say, oh, it's, you know, vaccines. Again, let's just focus on vaccines. No, this is a layered approach, is we have to do all of these things in order to reduce the chance of not only getting COVID, but spreading COVID. And that's the goal. You start from the left, which is masks, stay at home if you're sick, hand hygiene, high CO2 numbers, getting to fast and sensitive tracking and testing, quarantine, vaccines, of course, border controls, and ventilation. And at Windsor Regional Hospital, we have done a lot of these things, if not all of them, actually. And we've implemented all of them. Or the ones we had power over with respect to, you know, except for like border control. But you'll see from this Swiss cheese approach is there's not one single intervention's perfect at preventing the spread. You need all of them to be lined up. So if COVID makes it through the mask issue, maybe it'll get stopped at physical distancing and outdoors. The holes don't line up. And that's where the Swiss cheese kicks in. And that's why all these factors play an important role. And it's a layering approach. And that was most recently just articulated actually today by the Science Advisory Table. They came out with a report today on rapid antigen tests for voluntary screen testing. This is a big issue that's been discussed a lot, not only in Ontario, but in the United States with respect to rapid antigen tests and making them more widely available to individuals in the community in order to have them available. And if you recall, Windsor Regional Hospital started this for our staff back in August, 4 months ago it's been, since we started handing out these rapid antigen test kits for our staff. And I can tell you, it's gotta be easily north of a dozen, if not 20 cases, and they're all very similar, where an individual had a young person in their home who at the time either wasn't vaccinated because they weren't eligible for vaccinations, and or now really early on in the vaccination process, and they become positive, or what they're doing is they're doing the rapid antigen test on them at home, discovering they are coming up positive, doing the rapid antigen testing on the whole family. What that is preventing from happening is that's preventing the child from going back to school and spreading it even further, and or our staff member coming in the hospital. Yes, they're wearing PPE. Yes, they're doing the layered approach, but possibly spreading it in the hospital, or their partner in their household doing the same, or other family members. It has prevented that from happening because you jump on it early. So what happens with our staff is they get the rapid antigen test, then they go immediately, if they're positive under the rapid antigen, they go get a PCR immediately to make sure of the results. And in the meantime, they're isolating. So just highlighting some points that the science table stated is, I put in bold in the first paragraph, it produces immediately results, it's accurate, and it's a useful tool for detecting COVID early and isolating infected people before they have a chance to spread the virus. We've lived this for 4 months at Windsor Regional Hospital with our staff. Is that quote in and of itself, we've lived. The second one talks about their accuracy and talks about how studies have shown that CT values of less than 30 from an Abbott PanBio or any rapid antigen test gets around a 79.9%, 83.4% accuracy rating. And CT values of less than 25 increase that to 95% or 94% for the Abbott Panbio test, which is crazy. And you might, crazy high, I mean, which is amazing. And you might want to ask what CT values are and what that means. And Dr. Saad, I'm going to bounce right to you because you'll be able to explain it. And I can explain it, but you'll be able to explain it where people be able to understand it. So Dr. Saad, would you mind explaining what a CT value is on a test?
Okay, I'll do my best. Thank you, David. Essentially what a PCR test is, and this goes to the PCR testing, is it takes a small piece of genetic material from a virus or whatever you're looking for, and then it multiplies it until it's being able to be detected by the test that you're doing. So if you pick up a small amount of viral load and you have to multiply it 50 times before it's detected by the test, that means you've picked up a very small amount of the virus. But if you pick up a virus and you only have to multiply it 10 times or 20 times, that means there was a large initial sample that you can pick it up easier. So the cycle threshold value, the lower the number of the cycle threshold, that means the less times it had to be multiplied, that means it was there in heavier proportion. So to David's point, when a CT value is less than 25, that means there's quite a bit of virus present there. A rapid swab will help you rule out an infection with a sensitivity of over 90%. And we do know that some labs don't even report positive results unless their cycle threshold is less than 30. If it gets to 35 or 40, then you might be picking up small pieces of genetic material from something that maybe isn't the virus, and you've had to multiply it so many times just so it's detectable. So the lower the CT value, the more viral load you had in somebody, and this is where it's much more readily picked up by the antigen test.
So thank you, Dr.
Differently, David?
No, I would have said it totally differently to a point that I wouldn't even understood what I told you. But thank you for explaining that, because my understanding is that the Delta variant, the CT values are less, meaning the viral load is generally higher, and therefore the sensitivity is of the antigen tests are a little bit better than the alpha. But now Omicron, early on, they claimed that the CT values were very low, correct?
So again, yes, it has to do with the replication and how much virus is actually in the sample. So if Omicron, for example, replicates faster and is more easily transmitted, then you're going to have more of the virus in the nose. So when you're detecting it, the CT values will be lower. So so it really doesn't have to do with the virus itself, whether it's alpha, delta, or Omicron. It has to do with how much viral load you have. And some of the more infectious variants end up having more virus and more shedding in some way.
Right.
So they're easier to detect by PCR.
Right. So what the science table was saying is that the sensitivity, if your viral load's high, of course, the sensitivity of a rapid antigen test is that much greater, to the point of 95.8%, 96% sensitivity, which is very positive. And even on the lower end of the CT value, the positivity is still 80%. So what we recommend to our staff is that they do the surveillance testing if they're in a household like that, or about to go out to their loved one who might be elderly, their house, is to do the testing and to do it 2 or 3 times a week. And that way, when you work on the percentages, and that difference between, say, 80% and 100% is if you do it that frequently, chances are you're going to catch it and reduce the probability of getting a false negative as well. Also, what's being recommended by the science table is, depending on the number of cases you have per 100,000 in your community, should determine whether these antigen test kits should be sent out widely and who they should be sent to. So they're suggesting that in an elementary school or neighborhood, it approaches 50 cases per million, which corresponds to 35 cases per 100,000, which, as I stated before, we were north of 100 in Windsor, Essex, and we were almost 140 a couple of days ago. They recommend that all unvaccinated and completely vaccinated people be tested once per incompletely vaccinated people, be tested once per week. When the cases approach the other amount, which is 175 cases per 100,000, which we're starting to approach, unfortunately, they recommend that not only unvaccinated people, but also possibly vaccinated people be tested 2 or 3 times a week. The reason we take this approach at Windsor Regional, again, is the layering and providing that extra protection for our staff and our community. So I'm going to hand it over now to Karen Riddell, who's going to talk about our local Erie St. Clair statistics with respect to COVID.
So good evening, everybody. And just to preface, this data is accurate as of the moment that I recorded it on the PowerPoint. So one thing that we do is we do publish our data on a daily basis, and it's also reported publicly by the province. And it is based on the most accurate data that was entered at the time. So as of today, we had 22 active COVID-19 cases in-house at Windsor Regional, 5 of which are in the ICU. 6 of the cases are fully vaccinated, meaning that they're 14 days post their second dose. 3 were partially vaccinated, meaning they were either 14 days after their first dose or 0 to 13 days after their second dose. And 13 are not vaccinated, so either no doses or less than 14 days post first dose. And then we've got, so that results in essentially 73% partially or unvaccinated out of all of our cases that are currently in-house. At our partner hospitals across Erie St. Clair, we can see quite a bit of difference in the community incidence and hospitalization rates. So Blue Water in Sarnia only has 4 cases in the hospital. 4 of them are unvaccinated. Chatham-Kent, on the other hand, has 11 cases, with 1 being fully vaccinated and 10 not vaccinated. Hotel de Grace, our subacute partner, has 0 cases, and Erie Shores Healthcare has 8 cases, 3 fully vaccinated and 5 unvaccinated. Across Erie St. Clair, we have been challenged by bed capacity issues over the course of the last couple of weeks. We do know at Windsor Regional, we have added almost 35 med-surg beds and 5 additional mental health beds that we have had open consistently, honestly, since the summer. Our capacity today was running at about 90% this morning, the majority of our COVID cases being at the Met campus. We do cohort at that site, and that's really to preserve our trauma, cardiac, renal, neurosurgery, and vascular programs at the OLEC campus. So when we started the day today, we had about 13 med-surg beds available for admissions, and our volumes have been trending very high at both of our emergency departments, with an average of about 120 to 130 cases at each site per day coming in, with a 20% admission rate. So you can see how quickly that can cause capacity issues in the hospital. So in addition to those 22 active cases that I reported on the previous slide that are at Windsor Regional, we do have an additional 11 patients in the hospital that were admitted with COVID-19 that are now considered to be no longer infectious, so they're not counted in those daily bed numbers. And 5 of those cases are still in the ICU. So in the ICU, they're called COVID-related critical illness, and those are reported out through our Critical Care Services Ontario. So we do track all of those cases as contributing to capacity in the ICU.
All right, thanks, Karen. And I'm going to now pass it over to Dr. Saad, who's going to talk about Omicron and boosters.
Thanks, David. So I'm sure everybody here is now aware of the Omicron variant that originally started in South Africa. There is still a lot of unknowns with respect to Omicron, but what we do know so far is that it does appear to be more transmissible than Delta. And whenever a new variant comes out and appears to be more transmissible, it usually ends up becoming the dominant variant, just like Delta overtook Alpha in North America and most of the world. What we don't know yet is whether Omicron is deadlier than Delta. There's still not a lot of evidence whether that is the case or not. A lot of people who are becoming infected with Omicron appear to have milder symptoms. But of course, we know that if you end up infecting more people with a milder virus, you still may end up with larger numbers just by virtue of the fact that you're infecting more people. And then the final thing that we're starting to get a little bit more of a sense of is, are the current vaccines enough to protect us against Omicron? And there is some preliminary data that is good news that suggests that our current vaccinations, particularly with the mRNA viruses, will protect against Omicron, with the caveat that your immune system is boosted, meaning 1 or 2 doses of the mRNA vaccines does not appear to offer as much protection as somebody who has had their 3rd or booster dose, because we do know that boosters do improve your immune reaction and do protect you. So we are pushing for boosters as much as possible. We know that the ministry went from the 70-plus-year-olds to now 50-plus, and hopefully we'll open it up to as many as possible before Omicron takes a strong foothold in North America, and particularly in our region in Windsor-Essex. We have not had any confirmed Omicron cases locally in Windsor-Essex, although there have been in the province. And with how infective it is, it's just a matter of time that the number of cases will rise and it may overtake Delta, which is what the projections are showing. So for now, it appears to be more transmissible. It may not be deadlier, although it's too soon to say. And our current vaccines, especially with boosters, and most importantly with boosters, do appear to offer protection against Omicron.
So thank you, Dr. Saad. So I just want to close with everybody that you can receive your booster shot. You can sign up now if you're 50 years of age or higher. You can go on the WeVax website and sign up for your booster vaccine at the Devonshire Mall Vaccine Center. They're going to be administering those as early as Monday, December the 13th. I think we're booked into Wednesday now of that week, so the 15th. But please go online and book. If you still are a parent or guardian of a 5 to 11-year-old, please do the same and book for their first dose. We've had pretty good uptake with respect to those first doses for 5 to 11-year-olds. And those are clearly still available both at Windsor Regional, at the Devonshire Mall, and also in pharmacies and some primary care offices. If you're still just getting your first dose, period, you can walk right in and get your first dose and or second dose. You can walk right in to the Devonshire Mall Vaccination Center, and we will accommodate you as walk-ins for first and second dose. Except for if you're a 5 to 11-year-old, we ask that you book. And again, for 50 plus, getting your booster shots, book. As Dr. Saad just pointed out, the early information is if you're eligible for the booster, to get it, to protect yourself from Omicron and the variants. And it's been found as close yesterday as in London. I mean, theoretically, chances are it's here. We just don't know it yet. And it's been here. And it's just a matter of it coming forward. I mean, the UK is projecting that within 2 to 4 weeks, it will become it'll pass Delta with respect to its presence in the UK, which means we won't be far behind on how rapidly it seems to spread once it starts, and London being an example where it spread through a considerable amount of individuals very quickly. But again, so far, it looks as if the symptoms are mild, which is good, and that the vaccines are holding up, especially with the booster. So again, sign up to get vaccinated, very important to do so. And we really appreciate the community's support and the patience of the community to deal with the other issues that are going on. We really appreciate the community's support in the vaccination efforts and all our efforts for that matter. And on that note, I just want to wish all of the board members and our community a happy holiday. Please enjoy it with your family of 10 or less in your households. And please adhere to public health measures and public health rules with respect to if you are going out to a restaurant, et cetera. And always have your vaccine passport. And I think what's just while we're sitting here, it seemed to have a flash. There's going to possibly be some news tomorrow with respect to upping the ante with respect to what type of proof you need to show when you go into a particular event that requires a vaccine passport. So maybe the days of just showing a quote receipt are gone with, because I think the system they have, in my opinion, the QR code is a pretty slick system. Is when you do scan it with the Verify app, it gets the name on the Verify app and it matches up with the name on the actual QR code with the date of birth. So it's, in effect, a two-patient identifier. And if someone's got their driver's license or some other ID, it connects all the dots. And someone can't have a fake QR code. So it's a very solid system if it's used rather than just the receipts. So again, we'll see what happens tomorrow. So Mr. Chair, that's my report with the help of my friends. I don't know if there's any questions.
Yeah, does anybody have any questions for David or team? No. All right, well, thank you, David, Wasim, and Karen. You guys all do a fabulous job on AM 800 or CBC radio and all of our local stations, keeping everybody abreast of the situation as things come up. So you guys have been fantastic, and you definitely are going above and beyond your call of duty. So we all appreciate it. Next on the list is Dr. Jacobs with the Schulich report.
Thank you, Mr. Chair. Brief report. There is an attached one to the package as well. First of all, medical education is going well. We've been able to continue through the first semester here without any blips with respect to COVID. And so very happy to be able to continue with that. We did receive a visit from Dean Yu about 2 weeks ago as well. And the sort of agenda of that meeting was to meet with faculty in Windsor about increasing the really the recognition of the amazing work that's happening here in Windsor, Essex with respect to medical education. I can tell you that over the last 10 to 15 years that we've been here in Windsor, the faculty in Windsor have moved really from the group that have been delivering curriculum to now the group that is developing curriculum. And I think that's a huge win for us in the community. It does show the growth of education here locally, and it speaks wonderfully to how much effort everyone does put into making sure that medical education is a sustainable feature in Windsor, Essex, and not just something that we used to do. So from that perspective, we're thrilled, and there's a lot of optimism and a lot of excitement of how we grow this going forward, especially now as we move into fulsome planning for the new acute site hospital. I think the educational component really does allow us to do some really wonderful things going ahead. The only other sort of piece I wanted to bring to the attention of the board was really a recognition that it is a challenging time with medical education, actually for healthcare in general, obviously, with respect to burnout and stress on people involved in delivering healthcare, but learning healthcare. And so we're thrilled to announce that we've hired a full-time individual to work with the medical school and provide counseling services for students who might be in crisis as well. And that's a combined role that we've done with the Faculty of Nursing at the University of Windsor as well. So both faculties have shared hiring this individual, and we're quite happy with what that allows our students to do with respect to access for really crisis management and being available to them always and understanding them and their specific needs. That's my report. Thank you very much. Happy to take questions if there are any.
Perfect. Questions for Dr. Jacobs? Great initiative there. Kudos to you and the nursing school. That's fantastic news. So next up, we have our financial presentation with Penny Allen. Penny.
Okay, good. This is for the October 31st, 2021 report, actually, of it's 7 months of financial. as you see there, the hospital operations, 3.3 million deficit for hospital operations year to date. The net deficit after building amortization is 4,282,000. For new folks, I'm not sure if you know, amortization is basically another word for depreciation of assets. And so I thought I'd just mention that. The COVID-19 unfunded but eligible expenses total to 1,935,000, and then the ineligible is 1,740,000. So the unfunded non-ministry revenues and unearned volume funding total $7.7 million, and that is the non-ministry revenues. That, for example, parking fees from visitors who were going into the hospital who are not going into the hospital, or the cafeteria area, those kinds of things. The ministry never funded, but now that you're not getting it because of COVID and having to shut things down. Then we have funding. The ministry has now confirmed that both quarter one and quarter two in the fiscal year, incremental COVID-19 expenses will be funded, submitted and will be funded, yeah. Therefore, a total of 6.2 million of this funding has been accrued for these expenses. And for hospitals, for quarter three and quarter four, which of course are not created yet, screening costs remain eligible for funding. However, incremental PPE costs are no longer funded. That's mainly the masks. The ministry has made PPE supplies available for provincial stockpile at no cost to the hospitals. So I think that's a pretty good thing. And then we have revenue, and that is base and one-time funding is 20.8 million, favorable due to amounts that have been accrued for known COVID-19 reimbursements. These include the first and second quarter incremental expenses, temporary physician payments, vaccination and assessment center funding, and nurses extern funding. And then patient services revenue is 1,767,000 favorable, relates to uninsured patients revenue from the ministry and higher diagnostic revenues, which are offset by higher medical staff remuneration expense. So yeah, so that's that. And then the next one here is the is the COVID-19 impact on expenses at 1.1 million a year to date in extraordinary expenses and 3.1 million in lost revenues for a total of 4.8 million that is unfunded or is currently ineligible for funding. So that's not great. So and hospitals are still waiting for communications regarding treatment of lost revenues. So things are still kind of in a flux, and you have to wait for the ministry basically sometimes. So so expenses, 24 million year to date unfavorable variance in expenses. However, 29 million of the total 32 million in COVID-19 expenses are confirmed eligible for funding. So that is good. And drugs are 2.2 unfavorable, systemic, and renal drugs are funded by Ontario Health, and additional drug expenses are in retail pharmacies offset by recoveries. Other supplies variance includes 3,561,000 additional Evolve HIS project costs due to COVID-19 delays for which we have received funding confirmation. Utilities are favorable $1,097,000 year to date due to the continuing electricity rebate, which is really a good news because it was going to expire and then it got extended to October 31st. So that's my report, and I can move. I'm going to do a move. I move that the report from the November 29th, 2021 financial presentation as of October 31st, 2020 be accepted.
Perfect. Thank you. Seconded by Paul Lachance. Thank you, Paul. Questions or comments? Seeing none, all in favor? Perfect. I didn't see anybody opposed, so that carries. And then I think you're just going to move the consent agenda.
Yes, I am. Yes. That the report from the November 29th, 2021 Finance Audit and Resources Committee meeting be accepted.
Perfect. Seconded by Ian. Thank you, Ian. Questions or comments with regards to that? Seeing none, all in favor? Perfect. Thank you so much. We have the correspondence and printed material there for your information only. Any other comments, questions from the board at this point in time? Seeing none. The date of our next meeting is January 6th, 2022. It's strange to say. Happy birthday to a couple of our board members and one staff member here. So Mary Dawson, Patty France, and Jonathan Foster, happy birthday. Enjoy it with under 10 people. So can I get a motion to adjourn? Paul and then Genevieve, questions, comments? I don't think anybody's going to complain. Perfect. All in favor? Wonderful. If everybody wants to jump back online, I have a feeling this scrum might be a little bit longer than you, maybe not normal, but average. So why doesn't everybody jump back online for the in-camera session at 6 p.m. For everybody still watching, have a good holiday, stay safe, go get vaccinated, and buy your 50-50 tickets.